Medici per I Diritti Umani, or Doctors for Human Rights Italy, is an independent humanitarian and nonprofit organization supporting the right to health and implementing health projects for the benefit of the most vulnerable populations, such as migrants in transit. These are people who flee their country because of war, violence, and persecution, and who are passing through Italy in an attempt to reach the countries of Northern Europe, usually spending some days or weeks in precarious situations in train stations, squats, or overcrowded centers, attempting to remain invisible while organizing the next stage of their journey. MEDU tries not only to give health assistance to these asylum seekers and refugees, but also to record data and testimony about their journey, the conditions they've experienced, and the torture they may have suffered along the way, for use when advocating for policy changes to adequately confront the situation. They do this with the project Camper per I Diritti.
This is our camper.
A mobile health clinic operated in Rome by volunteer staff and doctors.
I'm Michela. I volunteer for MEDU, Medici per I Diritti Umani, and this is our clinic space. We got all the medicine. We offer medical cures to people that are in transit here in Italy, or maybe they're migrants. They're stable, but they don't live in really good condition, and they don't know how to access to the Italian public health system. So the people that come here don't live in really good hygienic conditions. The ones who are in transit come from a really long trip, a health problem related to a stressful condition.
I'm Alberto Barbieri, physician of MEDU. We see many women, young men, children in very precarious physical and psychological conditions. They were victims of detentions in Libya. They were victims of torture and violences with trauma and psychological problems. And they lived in Libya during the journey before arriving in Italy in very bad, poor reception condition. So we see also many infections of the skins due to this situation. And we see the same situation here in Rome.
Along with doctors and staff, MEDU also brings a cultural mediator.
The role of a mediator is very important because it's a bridge between two different languages and cultures. Because the immigrants that come here, they don't trust anyone. They are afraid you might take their picture or their fingerprints, and so they are afraid because if you take their fingerprint, they will not go to another country.
Many of the people interviewed did not want to show their faces, but were willing to tell us a little about their journey.
My name is Sami El Abraham. I came from Eritrea. I'm 18 years old. Yeah, I got here to this place because of some problem. This problem is the political and economical problem. It is a dictatorship. Then they came many people to European country to live freely. So it doesn't have any, in our country it doesn't have any right, human rights, because if you are learned, if not, you are a soldier. If you have came money from my family, I will go to Germany, then they will continue to Norway.
When you are in your country, you are sad. When you are go out, you are sad. That is always the same. Our traveling, it is very, very bad. But it is simple when you are compared from the Khartoum to Libya. I stayed 3 months in Libya. The fact is, when one bread for 1 day, I ate 90 days, I ate 90 bread. Only they give you what? Gun or steak. When you are talking, you have to sleep by your abdomen. Always day and night. They didn't end talking. When you are coming to the sea, you have one chance.